Hello and welcome back. Comparing once again, one of my favorite topics as of recent, the British healthcare system compared to the almighty wonderful US healthcare system. So this video is how the United Kingdom's healthcare system works. And already you see some comparisons here. That's why I paused it at this screen. But it looks like it's going to start off with some statistics such as this, and then go into how it works in general, because I'm still trying to wrap my head around it. And the stories that I've heard from how much things cost, what we've had done. I mean, it's crazy to me of how expensive things are here in the US, as we know now, especially if you've seen a few of the previous videos that I've reacted to, talking about costs and actually getting doctors talking about the costs, and they're even blown away. Let's dive in and learn even more, for me especially, and hear more stories from you about the UK health system and how it works, and this little comparison it looks like between the US, which we'll all be blown away by.
The UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming?
All right.
In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US, and the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. Anyone
surprised so far about this statistic? I'm guessing that is a big no. I could hear you through the screen.
The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system, so everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
I think that's just a complicated issue right there. Way over my head. But yes, of course, it's not quite free because it comes out of your taxes. That being said, I've seen a lot of comments explaining, well, this is the difference between, say, the US and the UK healthcare system. This is how much comes out of our taxes. And it's, as you saw from the chart before, especially if you don't have insurance in the US, you're completely doomed. You know, that would be big trouble. And I think I saw in another video something like 10% of the US and 28 or 25 million people of the US are in that bracket. They're just not insured. So imagine being here in the US with your knowledge, knowing how much things cost. Anything happens to you and you have to go to the hospital, that's where I've said, you half jokingly, you flee the country, fly to Brazil, never to be seen again.
I would call that socialized medicine. Government provides the care. Government pays for the care. It's paid for through taxes. Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
If the NHS, if that's socialised medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
Each of the UK's four
True.
constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs, but those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US. Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner.
Is that still true? Because I don't know when this video came out. It might be a little old, but I did hear about that, especially during like the COVID time. I think everything got all messed up during that time. But I've also seen a lot of comments saying, no, I get in, pretty instantly or very soon. So let me know how it is now, like modern, right now, how wait times are, because I did hear about that probably a year ago.
If you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
I also heard of this, and I do like the idea of having, if you want private sector, you have that option. I am all for options. And if you don't want to do that, no sweat. You're still very taken care of. The citizens are looked after. You are safe, and you're not going to be completely doomed from financial or windfall of going into a hospital like you do here, especially if you're not covered. Yeah, I do like that option. Maybe it's not popular there. I don't know. I don't know much about the private sector of the UK, but I would assume it's good. It's good. Options.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
Wow.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS is has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff, it takes it from the NHS, it cherry picks, takes the low risk patients, not the high risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved. And unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom...
So I didn't know Brexit was in this video, but I guess it would have quite the impact on the health service of the UK, at least, a bit of it. This is CNBC. I don't even know their views on things, but yeah, I had no idea this was in here, so... don't know which way they're going. Don't know much about them.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
Britishness, I like it. So that was that, and I dove into a couple things that I didn't even know that it would. But as always, I think it's very revealing to compare it to a few other countries that I've seen similar videos, and especially, as you all know, the United States, prices here, how we conduct it, and me to learn more about the UK healthcare system, and listening to your stories. As always, very eye-opening, enlightening to me. Really shows the difference between the two systems, a massive difference it is. And from what she said at the end, I do agree that it's very much loved in the UK. The NHS has, I would assume, largely been a success, takes care of the citizens, compared to here in the US where it's for profit. So we'll end it there. So thank you for joining. I'll see you all in the comments where I learned so much, and I will catch you all in the next video. Have a good, safe, healthy rest of your day.